For FASD Awareness Day 2020, I am going to read Chapter 13 of The Silent Epidemic, A Child Psychiatrist's Journey Beyond Death Row. With me is my little partner here, Sparky, as you see. Chapter 13 is Societal Solutions to the Silent Epidemic. Ironically, we humans enjoy combining alcohol and sex, which can lead to unintended pregnancy and inadvertent prenatal alcohol exposure. Since over half of pregnancies are unplanned, it is misguided to think that it is a woman's responsibility to know the risks of drinking during her childbearing years, or indeed while she is pregnant, when health professionals and governmental agencies are providing insufficient, or in some cases incorrect, information. It is in the interest of childbearing age patients and society to prevent neurodevelopmental disorder associated with prenatal alcohol exposure. Scientists in the public health community have known about the intellectual disability, learning problems, low birth weight, infant death, and other lifelong consequences of alcohol for several generations and have chosen a variety of inadequate measures to address it. Prohibition did not work, although largely influenced by the effect of maternal alcohol use on infant death and child mortality. Not even advisories issued by the U.S. Surgeon General have shifted the way we think about alcohol from a reproductive health context in the last 31 years. The focus has remained on women who are pregnant or planning a pregnancy. It is not enough to warn pregnant women about the use of alcohol, since the point of pregnancy recognition is already too late to prevent much damage to the wiring of the brain. To ensure the duty to warn society adequately about the harmful effects of alcohol prior to pregnancy recognition, consideration should be given to reintroducing a derivative of S-2047, the 100th, Alcoholic Beverage Labeling Act of 1988. Since alcohol as a beverage is both a food and a drug, it should be regulated by the Food and Drug Administration, not one of the poorest funded, smallest government agencies, that is, alcohol, tobacco, and firearms. The state of Alaska has taken on the epidemic of NDPAE by placing pregnancy test kits in bars and restaurants where alcoholic beverages are sold, with the aim of raising awareness about the dangers of alcohol use for women who may be pregnant. While pregnancy tests in bars may increase pregnancy recognition, the most reliable results come from a morning urine sample, which most women are going to be in a bar in the evening, not the morning. In the least, the test dispensers will have women stop and think about whether to have that next drink or even about their reproductive potential while at the bar. Maybe it will inspire them to use reliable contraception or to avoid alcohol if they have been having unprotected sex. Recently, the Centers for Disease Control and Prevention issued a report in its Morbidity and Mortality Weekly, encouraging alcohol consumers to use reliable contraception. A number of media sources reported backlash from women who found the advisory off-putting, sexist, and alarmist, even though within a week of the recommendation, the Zika virus outbreak led to both the CDC and the Pope himself encouraging women in endemic countries to prevent pregnancy. The time has come for physicians to encourage their sexually active, childbearing age, alcohol-consuming patients to use reliable contraceptives. Medical providers should work closely with other human service professionals to ensure that populations consuming large amounts of alcohol, that is, alcohol abusers and alcoholics who may be less able to abstain from alcohol use without intervention, have access to substance use treatment, outpatient, inpatient, transitional housing, etc. Every effort should be made to address the contraceptive health needs of these very high-risk childbearing age individuals. Another, albeit more upstream approach, would be distribution of condoms with an informational flyer about NDPAE for the first alcoholic drink of the evening sold to each customer. signing informed consent to acknowledge that a person understands and is willing to accept the risk to the unborn of unintentional exposure to an early embryo would allow another point of education to young people. A tax on alcohol by the bottle or by the drink imposed by local and state liquor boards, then earmarked proceeds to these NDPAE prevention initiatives, would help communities stem the tide on this preventable disorder. These monies could also be used to educate and provide medical and psychiatric care for affected individuals. The educational programming supports parent guidance, allied health therapy, and psychiatric care for individuals affected by prenatal alcohol can be costly even for adoptive upper middle class families, the modern day social service agency. What about birth families bearing the cost of the expenses for these children? Many are in the working class and working poor with little means to support their families' basic needs, let alone expensive health care and educational costs. By the time the child reaches school age, the parent is often so frustrated by the child that they have been abused, neglected, and feel disenfranchised from the family. More about parenting strategies can be found in Part 3, Appendix C, Parenting a Child with NDPAE. To that end, the following points support stronger legislation and action. Alcohol use, even before a woman may know she is pregnant, can cause physical, cognitive, emotional, and psychiatric and behavioral problems for her child. While NDPAE may occur with more than minimal prenatal alcohol exposure, the full-blown fetal alcohol syndrome, FAS, occurs as early as the late 3rd to early 4th week of pregnancy with as little as 4 to 5 servings over the course of an evening. At least half of all U.S. pregnancies are mistimed or unplanned. That is, the couple is not planning to become pregnant. This statistic has remained relatively consistent over the past 3 decades despite advances in family planning. Therefore, preconception initiatives are critical to reducing inadvertent exposure to alcohol early in pregnancy. Approximately 14 million women in the U.S. binge drink up to 3 times a month, with about 6 drinks per episode. If only 10% of these women became pregnant, then the outcomes would be catastrophic. The number of women who drink alcohol while pregnant consistently remained about 1 in 8, according to a 15-year study by the Centers for Disease Control and Prevention, and approximately 2% engaged in binge drinking or frequent use of alcohol. The results of the CDC study further indicated that more than half of women who did not use birth control and therefore might become pregnant reported alcohol use, and 12.4% reported binge drinking. Rates of NDPAE exceeds or rivals that of a number of other non-preventable concerning neurodevelopmental disabilities: autism, cerebral palsy, Down syndrome, and spina bifida. Since it is estimated that 1 in 20 American children have NDPAE, even if we were able to identify all of them, communities lack adequate neurodevelopmental services needed to address all of their complex needs. Much of the time, school systems are reluctant to continue individualized education plans for children transitioning from early childhood intervention programs into kindergarten. One child in my practice who had been kicked out of preschool for disruptive behavior was unable to get an IEP for kindergarten despite my urging the school administration that it could help prevent fight or flight reactions. Within a few weeks of school starting, the school staff called the police on the 5-year-old who had cocooned himself under the teacher's desk and became agitated when the teacher tried to coax him out to complete his schoolwork. In a SWAT team-style drill, the teacher cleared the room of students, called in the janitor and PE teacher, who pulled the boy out from underneath the desk and held him down until the police arrived. What had been a frightening ordeal that led to him hide under the desk became a traumatic experience for him and his twin brother, who watched the entire event transpire while he stood watching helplessly from the hallway. Truly, it takes a village, every village, to plan for, birth, and nurture children in a supportive, safe, and humane environment. This will mean rethinking the idea for safe harbors and sanctuaries in pastoral settings, the initial concept of asylums for those socially and emotionally fragile human beings. From a local community-based perspective, creating alcohol and substance-free housing for families of origin to raise their own children will be a giant leap toward fixing our fractured foster care system and breaking the vicious cycle of early childhood trauma. As opposed to fostering children to be raised by strangers, we need to rethink policies that foster parents by offering safe and drug-free residential communities and minimizing marketing of alcohol to low-income, minority, and socially disenfranchised populations. Children, adolescents, and families with NDPAE need greater access to mental health care, targeted approaches to treatment, and improved community-based resources, including educational and vocational programs, healthy social outlets, and recreational activities. Such programs are much less costly than lives lost due to unrecognized and untreated neuropsychiatric issues. Societal priorities must shift toward the mental well-being of our children and future generations to come. We are all blessed with talents, aspirations, gifts, and dreams. Knowing these weaknesses and working hard to overcome them brings the promise of success and fulfillment compared with life of struggles and frustration. I do not see children who are damaged or defective. I see the promise of a future that is clear due to the insight a diagnosis gives them. This silent epidemic will require a revolutionary paradigm shift in our social conscience to reduce its skyrocketing trajectory. Such a paradigm shift is necessary to break the bonds of social enmeshment with alcohol, a drug with limited benefit to society outside of its properties as an antiseptic, chemical, and alternative to fossil fuel. It is now time for society to face the reality that its social drug of choice is aborting human potential silently within the womb. The paradigm must shift toward upstream primary preventive measures which create healthier reproductive health attitudes and lifestyle behaviors. It is my hope to fuel this new era in women's reproductive health led by the Centers for Disease Control and Prevention, including preconceptional health planning and contraception for alcohol users. However, in rural and socially disenfranchised communities, it will take more than government ads to turn the tide on this tsunami of lost potential. It is in the spirit of healthier futures that I write, with hope for alcohol-free pregnancies from the preconceptional period through the end of lactation. Breastfeeding. Informing the public of the fastidiousness of our early developmental stages will be a giant step toward ensuring that future generations have the capacity to fully appreciate the universe in which we live, its forests and flowers, textbooks and tests, microbes and mountains. Until preconceptional measures are embraced, the rarity of human genius from Leonardo da Vinci, Antoine von Leeuwenhoek, Ludwig van Beethoven, Charles Darwin, and Albert Einstein may become forever extinct. Thank you for listening, and hopefully over the next few days and the remaining days of the month of September 2020, you will consider fetal alcohol spectrum disorder and what you might be able to do to either prevent or begin recognition of this very unrecognized and treatable condition. Thank you and have a great evening.